Hey y'all, it's Dr. Shawn Tassone, America's Holistic Gynecologist, board certified in OBGYN, also board certified in minimally invasive gynecologic surgery and hormone expert. And I get emails a lot from people, and I get things like, "Hey, I'd like for you to respond to this." And one of the doctors that I constantly get information from or on is Dr. Jen Gunter, who's also a board certified OBGYN. I've known about Jen for probably 20 years. When I was in the military, she used to blog and write a lot about her premature babies. I think she had twins when she was younger, and it was a premature delivery. And she started kind of going online with all that stuff. And then she started her campaign about wielding the golden lasso of truth and kind of stamping out stupidity in this space. And for the most part, she does do a lot of that. But the problem is that she's really negative about everything, including physicians, including people that aren't her, don't believe in what she does. And I will be perfectly honest. I will also say things about companies that are lying to patients, that are telling them things work when they have no data and everything. But I think that there is a bit of a miscommunication when it comes to the hormonal piece. And part of it is that you can't see outside of your own blinders. And when you only follow certain criteria and training and whatnot, that you kind of miss the boat on some of it. So she has a podcast as well, and I probably would have you check it out, because all information is good information. But she has a blog, and one of the blogs that was sent to me was the 12 steps to evaluate menopause content, which is funny because this is what she's putting out, is menopause content. So I wanted to go through the 12 steps and kind of debunk her, maybe agree with her, maybe disagree with her. But she says, I think the best way to sort out expertise is to favor content over credentials. This helps weed out OBGYNs and anyone else who is giving bad advice. Now, when she says that she's wielding the golden lasso of truth, she's wielding her golden lasso of truth. It doesn't necessarily mean it's mine or anybody else's. It's what she believes. Now, she will say that she backs that up with research, which is great. I'm all about that. And I think that's super important. But also, there is some importance for personal experience and whatnot. She says it also acknowledges that there are great advocates who may not be medical providers, which is good. I think that's also a good thing to talk about and to pursue, because there are people out there that are saying good things that are wonderful, that aren't necessarily OBGYNs or doctors. There's a lot of good nurse practitioners and PAs and health coaches and whatnot, as long as people aren't promoting stupidity and false claims so that they can make a buck, which I think she and I both agree on. So number 1 out of 12 things on her list is, if they are not prescribers, are they staying in their lane? She says, if you follow physical therapists, nurses, dietitians, health coaches, and other non-prescribers, and there are some excellent ones, just remember, like doctors, there are also some truly awful ones. Pay attention to how they promote their content. I agree with her on this, totally. I think that there are definitely scammers out there. There's grifters in this space. I've talked about a lot of them before. Gary Brecka, Josh Axe, Vani Hari, the food babe. I mean, there are a lot of grifters out there. And unfortunately, the grifters because they have big platforms, they get put to the forefront. You could just see the people right now that got asked to present at this rally outside of the Food and Drug Administration's nutrition talk that they had. Vani Hari has absolutely no credentials for nutrition, absolutely zero. Why was she asked to speak at that meeting? Why was Josh Axe there? Most of the people there are grifters. Unfortunately, they have huge platforms, and most of them don't say stupid things. They do make some sense, but then they also make up problems at times, and they will make up a problem, and then they'll make up a solution that just happens to make them money. I'm not against people making money. I just think that it needs to be done in an ethical manner. So if they're not prescribers, are they staying in their lane? I think this is important, and I totally agree with this one, because there are a lot of people out there who have never actually even seen a patient. There's doctors out there that don't see patients. Mark Hyman, he used to, he doesn't anymore. Casey Means, she doesn't see patients anymore. I mean, it's like, but they have these big platforms and they get recirculated by all these other people out there that don't see patients. So are they credentialed? Do they see patients? Do they prescribe? Do they actually have any training in what they're talking about? Number two, she puts, and this is pretty funny, avoid chiropractors. They are not medical experts. I don't know what they study, but it's not medicine. I think there's good and bad. The Wellness Way is a horrible example of chiropractors running amok. I think they promote complete trash. Flynn, the guy that runs that organization, is a huge charlatan, makes stuff up all the time. But then I have some really great friends that are chiropractors, and they don't always do things that I agree with, but I respect them as human beings, and I trust that they are being ethical because I believe that they're good people. Maybe their take on the data is different than mine and what works, like rectal ozone. Probably not something I'm ever going to agree to, but I have a really good friend that promotes it and does it, and I respect him as a human being, as a professional, and so I'm just going to say he must know what he's talking about. It's just not something that I want to promote. And that's okay. There's room for that in this discussion. And there's room for people doing things a little bit differently. To throw away an entire genre of training like chiropractors in one fell swoop is kind of, in my opinion, a bit egocentric and a bit narcissistic. Granted, when they put up, I think I just saw this yesterday, where a chiropractor put up the training of a chiropractor versus the training of a medical doctor, and they like to show that they do more hours overall. The reality is that the training of a chiropractor is somewhat similar in that they learn anatomy and physiology and all that stuff. What they forget to mention is that we also do 4 years of residency after that initial 4 years of medical school. So our hours are completely dominant when it comes to the amount of training. And if that's their whole crux, is that they have the same amount of hours, that's completely destroyed by the fact that once they graduate chiropractic school, they're done. They don't do any extra training. Now, they can on their own. But for chiropractors to say that they're hormonal experts, to me is false, just as much as it is an emergency room doctor telling you that they're, experts in hormonal training, because they're not. They went to a course and they maybe learned on the job, but they're not experts. Number 3, she puts, is, do they recommend thermography? Now, this is one that I agree a little bit and I disagree a little bit. She says, thermography is not recommended for breast cancer screening. That is true. Thermography, though, is and has been shown to be a positive factor if it's done, and a mammogram is also done. So doing both actually can give you more data than just one. I would personally not use thermography as a standalone therapy. We know that's not what it's supposed to. That's not what it's supposed to be done. And unfortunately, there are a lot of women out there that do that because they're distrustful of mammography. They think that there's a lot of false information out there that digital mammograms have like 10 times the amount or 100 times the amount of a regular mammogram. It's totally false. Not even remotely true. Actually, a digital mammogram has about 1/10 of the radiation of a chest x-ray. So there's a lot of misinformation. So that's probably part of this. So I am kind of like somebody that thinks mammograms or thermograms can be helpful. I don't have a problem with people getting thermography. I just don't recommend doing it alone. I would recommend getting your mammograms, but I wouldn't substitute a thermogram for a mammogram. Whereas I believe she doesn't feel that mammography is a good thing at all, or thermography is a good thing at all. Do they recommend compounded hormones? Number 4. She said this includes testosterone and estrogen pellets. Well, she's lumping in pellets with compounded hormones, which is completely wrong. She also mentions Wiley Protocol, which I would agree with her on. I think Wiley Protocol is a joke. Anybody promoting Wiley Protocol is a joke. And anybody that promotes Wiley Protocol is telling you they're holding up a huge sign saying, I have absolutely no idea what I'm doing. You have no idea if you're getting too much or too little hormone. It turns out it takes years of research to figure out how to formulate hormones so they can be absorbed. Bullshit, bullshit, bullshit. In addition, compounded hormones are not batch tested. Bullshit. The only indication for compounded hormones over standard pharmaceutical hormones is when someone has a true allergy. Bullshit. And the best example here is someone who wants to take progesterone but has a peanut allergy. Okay. So she's saying it's okay, but only if you have an allergy. Well, that's just dumb. That's the stupidest thing I've ever heard. That's somebody that's negating their own damn argument. If it's safe enough to take if you have an allergy, then why isn't it safe enough if you don't have an allergy? What you're saying is you're only pushing the pharmaceutical tagline. You only believe in the pharmaceutical grade products. Not that she's getting any money from them. I probably think she's not, but that's bullshit. I think that there has been a lot of research done on hormones, and there isn't research done on compounding per se, but the hormones that are used in the compounding have been researched extensively. And so you can know if it's being absorbed. Why? Because you do labs and you can see if the hormone levels are rising. You can talk to the patient and ask them if their symptoms have gotten better. This is not rocket science. This is just following up with patients. Unfortunately, you can't just give somebody a hormone and then set them on their way. You want to follow up with them. I would hope anybody does that. Whether you're using pharmaceuticals that you can get from CVS or you're doing compounded hormones, you follow up with the damn patient. So I totally disagree with her. They're big money makers. I don't make a goddamn cent off of a prescriptive hormone. Never have, never will. I make absolutely no money from a compounding pharmacy. They might take me out for dinner on Christmas, whatever. I send them tons of business. I don't get a dime from them. So that's just somebody that doesn't know the system or is grappling with trying to say something negative. Why do some providers push compounded hormones? She said, they're big money makers. They upcharge for the faux customization and often do unnecessary blood work. Again, blood work is never unnecessary. Blood work is necessary. If blood work wasn't necessary, why do we have the tests in the first place? Why do we have estradiol, progesterone, free and total testosterone, DHEA, thyroid? Why? Because they're not accurate? If they weren't accurate, why the hell are we ordering them? So again, her argument falls flat on its face because she's negating herself when she says that lab work is unnecessary to manage therapy and you absorb the cost with zero benefit. That's totally false. And it's not just absorption. You can give these compounded medications orally. You can give them sublingually. You can give them vaginally. There's different ways you can do it. And you can certainly measure the absorption. I see it all the time. I've been doing it for 20 years. I've seen 50,000 patients. I do it all the time. What she's saying just simply isn't true. Do they use the term estrogen dominance? This is a meaningless term and it is in no medical dictionary because, well, the medical dictionary is the end all be all apparently. And apparently the medical dictionary hasn't changed in 100 years. Like they haven't added new terms. They haven't, here's what she's saying. Medical literature does not talk about estrogen dominance. And so we get hung up on the term. In the allopathic world, we don't use the word estrogen dominance. We might talk about estrogen levels being high or something like that. But we don't talk about estrogen dominance, although there is an ICD-10 code in medical circles called hyperestrogenism. So instead of using estrogen dominance, let's call it hyperestrogenism. And then we can all talk about the same thing because, hell, that's a real thing. So that being said, if somebody uses the term estrogen dominance, I do, in fact, agree with her on something. A lot of the grifters out there, a lot of the charlatans, a lot of the people that have no credentials that are selling a supplement will indeed use the words estrogen dominance to sell a supplement like DIM that has absolutely no effect on estrogen levels, as I've talked about extensively. But that doesn't mean that a high estrogen, low progesterone doesn't cause symptoms. It just means that there isn't a definition for it in the medical literature. It doesn't mean it's not a thing. It doesn't mean that 5 or 10 years from now it won't be a thing. So she's right in one sense, but I think the logic is a little bit faulty and a little bit jaded. Do they recommend testing for MTHFR variation? And she's done extensive blogs on this, but she said, it doesn't really matter. So testing for this variant, she says, is like checking eye color and then making special recommendations for everyone who doesn't have brown eyes. I think this is a little short-sighted in the sense that we do know that people with MTHFR issues can have higher rates of miscarriage. They can indeed have higher rates of blood clots. We know this because the maternal fetal medicine doctors, or the doctors that specialize in high-risk pregnancies, will put women that have MTHFR variants on anticoagulants like Lovenox, heparin. They will actually put them on those medications. If it was complete hogwash, then we wouldn't do that. So I don't understand. I think, again, yes, it's overutilized. Yes, it's used by the charlatans. Yes, it's used to sell supplements. But again, it doesn't mean that it's not necessarily right. I think that what happens is we throw the baby out with the bathwater because there's some bad apples in the bunch, and we just say, well, all the apples are bad because of these 6 bad apples here. And unfortunately, that's not the case. What happens in the functional medicine world is there will be the people out there that take a nugget of truth. They'll build an entire platform around it. They'll milk it to death, and then they'll move on to the next thing. The way you can tell a grifter in this space is if they are constantly moving, picking and moving. Like if 1 week they're doing, or 1 6-month period they're doing fasting, and then 6 months later they're doing MTHFR, and then 3 months later they switch to estrogen dominance. If they're constantly moving around and they're not staying in a particular lane, like I talk about hormones all the time. I don't usually go off on MTHFR. I don't usually talk about migraines, and pretend I know something. I stick to my lane and I beat it to death. The grifters will move to whatever is big, vitamin D, whatever it is. They'll keep moving. And the reason they keep moving is because they're going to milk it to death, and then they're going to move on. And unfortunately, it's these bad apples that make it bad for the rest of us. Number 7, do they recommend salivary hormone testing? And she just says, super scam. With this, I would totally agree with her. The one area where I wouldn't agree with her on is cortisol. You can indeed check cortisol through saliva. I wouldn't use it for any other hormones. I do believe that salivary testing is only ordered by people that can't order blood tests because they're not licensed practitioners. They also will upcharge you on the salivary testing that is completely worthless. Saliva has been shown over and over and over again to be completely unreproducible and unreliable. You could take a blood sample of somebody and it has a completely different number than the actual saliva. And that's because people secrete hormones differently. They might have eaten differently. They might have not taken the test the right way. Completely unreliable and not reproducible. I would definitely stay away from salivary testing. Number 8, do they recommend the Dutch test? Well, she could have thrown this in with the saliva. She said, there's no indication for this test. We don't make any therapeutic recommendation. And she's wrong. She basically boils it all down to Mindy Pelz, who I'm also not a big fan of, who is a chiropractor. And you have to dig to find out that she is a chiropractor and not a medical doctor. Again, Dr. Gunter is correct. Mindy hides her credentials. She promotes herself as a physician, but she's not. And I think that's ethically impaired. Mindy said in an interview, I think we could end breast cancer if every woman were to take a Dutch test. And that is completely false. And unfortunately, Mindy is one of those grifter types that's being promoted by all the other grifters out there. She has a big platform and she gets asked on all these cool podcasts, but she's not an expert in hormones by any stretch of the imagination. Now, I would disagree on the Dutch test. I think it is a good test. I think it's overutilized. Again, it's sold directly to consumer and it's sold to anybody that wants to order it. So that's why the charlatans use it. The people that have no medical license will use it to sell supplements. Dutch, the company that makes Dutch Precision Analytical, very intelligent people, very smart people. They know the reason for their testing, they know that there are a lot of people out there that will sell supplements based on the test. They even give supplement recommendations on their tests. So yeah, it's a moneymaker. And yeah, I do think it's overutilized. I would say if I see 1,000 patients a year, I might use Dutch 10 or 20 times. It's just not something that I order a lot because it has cost. The results take about 3 to 4 weeks. I don't not use it because I think it's wrong or I think it's inaccurate. I think it's a very accurate test, but it costs money. So the test costs $250 to the providers. So if you're paying somebody $700 for a Dutch test and an interpretation and they're not a doctor, you're getting totally ripped off. Because that test cost them $250. So they're charging you $500 for their uneducated sales pitch, basically. So you have to look at who's ordering the Dutch. The Dutch test itself is not bad. I think it's just the person that orders it might not know what the hell they're doing. And I can tell you, because I'm on a Dutch test Facebook page, the questions that the providers ask in there are downright ignorant sometimes, and knowing that people are paying them thousands of dollars so that they can go then onto a website and ask the other people that don't know what they're doing what they should do for this patient. I can't tell you how many instances I've seen where somebody comes on there and says, hey, this is my first Dutch, what should I do? And somebody's paying them. I mean, that is ultimately ridiculous and shameful and unethical. Number 9, she says, is hormone therapy their only recommended solution? There's many ways to manage menopause symptoms, and they're not all estrogen-based. I would agree with that. If the only content you see is estrogen, 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 there's a good chance you are not getting evidence-based recommendations. For example, right before fezolinetant, the non-hormonal medication for hot flashes, was approved, the company had an ad during the Super Bowl to raise awareness about hot flashes. Of course, this was to increase sales for the product. Now, what she's doing here, again, and this is from the North American Menopause Society, what they do is they reduce women down to hot flashes and vaginal dryness. And so, as you're well aware, there's a lot of medications out there for hot flashes, but what about fatigue? What about hair thinning? All these other things that are going along with perimenopause and menopause. So basically, she then goes on to say a truly holistic approach means offering a wide complement of therapies. And if an influencer insists that estrogen is the only game in town, that means the provider isn't a menopause expert. They are an estrogen prescriber, and there's a big difference. She's really blurring the lines there. I don't think her argument is very strong. It's pretty weak, actually, because we also talk about other hormones, progesterone, testosterone, DHEA, vitamin D. It's not just estrogen. So I think she was just looking for something to bash people on. This is my favorite, number 10. Do their recommendations match the guidelines? Meaning the Menopause Society, the North American Menopause Society. I've done an entire podcast on the 2022 recommendations from the Menopause Society that, in my opinion, are a fucking joke. They are literally only talking about women under the vein of vaginal dryness and hot flashes. That's literally what they reduce women down to. And because of that, they only talk about FDA approved patches and pills. They don't talk about testosterone at all. They don't talk about thyroid testing at all. They don't talk about all the other symptoms that you struggle with. And their recommendations usually stem around pharmaceuticals, antidepressants, to just fix those two problems. The North American Menopause Society is horribly short-sighted. They are funded by not only big pharmacy companies, they're supported now by big supplement companies as well. So they get their, they're going to push where they get their money from. I mean, that's obvious. They're not getting their money from compounded pharmacies, so they're not going to recommend compounded pharmacies. I think that's completely short-sighted. They're not necessarily out of date. Their recommendations are up to date, but they've reduced women down to 2 symptoms, which is completely ridiculous. I think the North American Menopause Society is a joke. So the fact that she hangs her hat on the Menopause Society teachings is pretty funny and tells you a lot. Number 11, how do they profit? And she says, this is a big one. You need to consider the tests they order, the hormones they prescribe, whether they get money from pharma or from selling supplements or even the ads they are taking out. For example, if a doctor does an advertisement for the Clear Blue Menopause test that is not supported by any evidence, approach, or medicine, what does that say about them? Did they shrug the guidelines that recommend testing, that doesn't recommend testing, or whatever they got for the ad? Okay, again, her whole thing is whether or not people make money. I'm assuming that she makes money on her books. I'm assuming she makes money on patient visits she does, but you shouldn't make money on a supplement, I guess. So if you go to the store to buy one, the grocery store makes that profit or the company makes the profit from the website. But a doctor shouldn't do that. We shouldn't make recommendations. That argument kind of falls flat on its face, and it shows the hubris and, in my opinion, a little bit of jealousy, I think, to say that every supplement is complete trash just because somebody makes money on it is ridiculous. Now, are there a lot of supplements out there that falsely advertise? Yes. Are they complete garbage? Yes. But there's some that aren't. And there are some that make people feel a lot better. I remember years ago when I was delivering babies still, and I checked vitamin D levels on everybody. And the American College of OBGYN came out and said, you don't need to check hormone levels you don't need to check vitamin D levels, which I never understood because vitamin D is super important. And for us to just say you don't need to check for it is somewhat ridiculous. So then she goes back to the fact that the chiropractor, Mindy Pels, loves her Dutch test. Again, you pay an additional $550 and you get the Dutch test. So a little bit of jealousy. I wish that she would do this in a non-confrontational way because she does make some really good points. But I think that it comes across as a lot of anger. And unfortunately, people don't respond to that very well. I think sometimes when a traditional doctor blasts some of these grifters, they actually turn people towards them because that whole mythical premise that, well, if they're opposed to you so strongly, you must be saying something right. That always cracks me up. Finally, number 12. Do they lead with fear about recommendations for hormone therapy? Did you come away from the content regularly worried or anxious that you will get dementia, blah, blah, blah? So here's the thing. Yes, there are marketers, and marketing is a big deal. And there are people that do marketing that will say you need to hit the pain points and you got to hit them hard. So that's what some of these people do is they will hit the pain points. They'll talk about weight gain. They'll talk about dementia. They'll talk about osteoporosis. It's not all wrong. I mean, we do want to prevent osteoporosis, and we do want to talk about dementia. We know that in a recent study that came out that women over the age of 65, 10 million women were looked at. They have decreased rates of dementia, decreased rates of breast, colon, and lung cancer, and that's from using estrogen over the age of 65. There is data to support the use of these hormones in women that have some of these issues and that these issues do get better. Does that mean we shouldn't talk about it? I don't think so. I don't think talking to a patient, what I do is I tell patients what I see on the labs, and then I will tell them. I ask them in the very beginning about what they're feeling and why they called. But I will then talk about, okay, so low testosterone can usually feel like this, 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 and this. If they resonate with it, great. If they don't, they'll tell me. I don't try to scare people. There probably are people that use fear as a selling tactic, but a lot of us don't do that, and we let the patients make up their own mind. So you can see, I would agree with some of what she says. I disagree. The number one thing that she referenced was the North American Menopause Society's position statement, which is a crock of shit, in my opinion. That's just me. So you can see there's different ways of thinking about things. Doesn't mean they're right or wrong. I would never say that any provider, any doctor out there, MD, DO, that has this ability to do the training, do the work with patients is necessarily right or wrong for ordering labs, for ordering compounded hormones, for doing it. It's all in an effort to help the patient. To have the hubris that you think that your one view is the only view, that is the only correct view, is extremely short-sighted, and unfortunately is the dominating thought process in allopathic medicine today. I'm happy that she's bringing these points up. It does stimulate a discussion, and I agree with her on a lot of them, actually, but some of them I completely disagree with, and that's good because that's what it's all about in this country. You can have those discussions. So just wanted to kind of talk to you about different viewpoints, how you can look at things, how you can look at how, what people are talking about, and how you can evaluate content. So I'll be happy to talk to you online. I'll see you on Saturdays. I'm on Instagram, Shawn Tassone MD. I have a YouTube page, Shawn Tassone MD, and I do have a membership currently where if you go to my link tree, or if you want to go to www.thehormoneproject.com, you can get involved with my monthly membership where I do live broadcasts. You get discounts on supplements you might be using. You get a discount on an initial visit if you're already not a patient, or if you're not already a patient, and you'll get a free book. I will have experts come on every other month and talk about their vantage points, whether it's thyroid or cortisol or any of those things. And then I've recorded about 20 hours worth of videos already that have different topics. We'll go over things, each of the hormones, endometriosis, fibroids, whatever it is you want to talk about. That's at thehormoneproject.com. Thanks for listening. I hope you had a great week. This is Dr. Tassone. I'll see you on the other side.